All right, how's it going, everybody? Jacob Kronbeck here again. So, this time I'll be talking to you guys about osteoporosis. So, what it is a skeletal disease that is actually characterized by a low bone mineral density. It can also change the microarchitecture of your bone and also increase the um, possibility of a fracture. Osteoporosis affects almost 1 in every 2 women at some point in their lives, and more than 54 million individuals in the United States also have osteoporosis or have a low bone mineral density. There is also a recent evidence that suggests that exercise can actually delay the onset of osteoporosis and reduce the risk of fractures. So, in exercise testing, using a cycle leg ergometer as an alternate to a treadmill for exercise testing is actually recommended for those who deal with the severe osteoporosis. And then also those with multiple vertebral fractures can lead to a loss of height, and then any of those spinal deformations can actually compromise the patient's center of gravity and shift it forward. So the maximal strength testing is actually counterintuitive, as you might think anyway, in patients with severe osteoporosis, even though there is actually no established guidelines for maximal muscle strength testing. Balance testing is actually something that is also very much so recommended, especially with those who have osteoporosis as well as those with low bone mineral densities. So, some fit recommendations as far as aerobic is usually 4 to 5 days a week. Intensity wise should be moderate, using about 40 to 59% of heart rate reserve, and then also using the CR10 scale, usually with a rating of 3 or 4 should be appropriate with establishing that intensity. And then time, just starting off with about 20 minutes and then gradually progressing to a minimum of 30 but a maximum of 45 to 60 minutes. And then the type of aerobic, either walking, cycling, or any other appropriate aerobic activity. And then with resistance, start off with 1 to 2 non-consecutive days a week, and then you can progressively work up to 2 to 3 days a week. And then always adjusting the resistance so that the last 2 repetitions are usually challenging for them to perform. And then also having a high intensity training is going to be beneficial for those who can, so that they can tolerate it. And then just beginning with 1 set of 8 to 12 reps and increasing that to 2 sets after 2 weeks, and then not having more than 8 to 10 exercises per session. And then using just standard equipment can be used with any adequate instruction and safety considerations. And then flexibility, that last column on the right there, usually 5 to 7 days a week in order to stretch out the point of tightness or slight discomfort. And then just being able to hold that static stretch for 10 to 30 seconds for about 2 to 4 reps with each exercise. And then just static stretching of all of those major joints. So, exercise training. Actually, this one is fairly interesting because currently there is actually little evidence that exists regarding the optimal exercise regime for those individuals or those with the risk of osteoporosis. In general, weight-bearing aerobic exercise in combination with some of those those high impact, high velocity, and intensity resistance trainings is considered the best choice for either population. But what kind of has been found as those benefits that exercise on the bone health can occur both in children and in adults, This is primarily due to that increase in bone density, volume, and strength. Thus, exercise can actually be regarded as the primary non-pharmacological treatment for actually preventing osteoporosis. So, some special considerations to look out for. It can be difficult to quantify exercise intensity in terms of bone loading forces. However, the magnitude of the bone loading force generally increases in parallel with those exercise intensities. And then there's also currently no established guidelines, like I said before, regarding the contraindictions to exercise for individuals with osteoporosis. In general, those recommendations is to prescribe moderate intensity, weight-bearing exercise that does not cause pain. And then also, kind of highlighting this a little bit before, but falls in those with osteoporosis increases that likelihood of bone fracture. And then exercising dealing with increasing balance should also be considered. And then after beginning an exercise program with those who have a low bone mineral density or have osteoporosis should remain as physically active in order to preserve that musculoskeletal integrity. Thank you guys for stopping in. Have a good day.